I'm David Lauterstein. I'm going to talk about the advanced clinical training here, why at a beginning level 500 hours is fantastic, but really when you want to move on, be a masterful therapist, you definitely need an advanced level of training. And so I want to take a look at how an advanced level of training can help you understand one structure that is perhaps the most important structure in the body, that's the foot. Because the foot is a foundation, the foot leads to everything else in the body, and if there are problems with the feet, it radiates out through the entire structure of the body and the mind. And so let's take a look at some of the complexities of the foot that yet are simply built into it. One is, and very important, you've got three cuneiform bones here. The medial, intermediate, and lateral cuneiform bones. They form really the center of the foot. And significantly, when you turn it around, what you can see is that these bones at the bottom are much narrower than they are at the top. What that does is that creates the arch. Here's the middle cuneiform, here's the one next to it and the one next to it. By having this shape, you create context where the foot has its arch. This is essential for foot health. And so how do you address and massage the cuneiform bones? Well, what we're going to look at is that you can make a real clear contact with the cuneiform bones. You can add length through the foot because the foot under stress is compressed. And you can add room between the cuneiform bones, which otherwise lose their resiliency when they're just stuck together overly much. And we can do this all through a very elegant technique that's part of zero balancing. And what I'd like to do is show you that. So, in order to evaluate the movement through this critical area, what I'm doing is imitating the motion of walking. And I can see clearly how movement is or isn't traveling through these tarsal bones. You've got to check this. Then I'm going to nestle in with my hands to the tarsal bones. And I'm going to add length through them in the whole body with a straight pull. Then I'm going to bring in just a little bit of a curve and add length through the tarsal bones. So I'm pulling a little more toward myself. I'm pulling a little bit up toward the ceiling. And also by using this curved form, we're getting a spreading of these cuneiform bones. So the person starts to experience a cushioning effect through the middle of their foot, where usually it lacks it and critically then affects everything else negatively above. Hold that for a while, hold it, hold it, hold it, and give the person a chance to kind of let go of the excess tension they have in their upper body, excess energy in the upper body, and let that be more balanced through the whole self, and then disengage. And then you can reevaluate and see the greater freedom. So that's just an example of a simple thing you can do, but understanding the profundity of the body that the clinically integrated training allows you to do. That is just one of the techniques that you learn out of hundreds that we teach in the advanced clinical training. Advanced clinical training is integrative. It helps the person more. It helps you more as a therapist to get therapeutic results that will make your clients happier, that will make you happier, that will make them coming back more certainly, more frequently, and therefore, of course, it'll affect your income well. But most excitingly, it'll give you the tools that you need to really help people as much as you possibly can.